In this video, we talk about dynamic occlusal relationship, and this involves translatory movement of the mandible, and smooth transition of the mandible is achieved provided the shape, anatomy and position of the anterior teeth are correct. Now, when we look at the functional surfaces in anterior guidance, it is the palatal surface of the maxillary anteriors and the incisal edge and labial surface of the mandibular anteriors that play a key role. When we look at the anatomy of the maxillary incisors, they are designed to have a concave profile whilst the proximal ridges are convex so that they can provide the desired protrusive guidance. When you look at the maxillary canine, the canine tends to have a pronounced median ridge. This is ideal for a canine to provide the desired lateral guidance. Now, it's important to recognize that closing into MIP and then sliding forward is the ideal way to get the desired guidance that your patient has. So how do you get your patient to show you the correct guidance? You put in your articulating foil in the patient's mouth, have the patient bite down in MIP, with the teeth in contact, have the patient slide the jaw forward, go back into MIP, slide the jaw laterally and come back. Now, what is important to recognize is this is from MIP going outwards. This is never a physiologic movement. A physiologic movement for the patient is always out towards MIP. We often tend to find patients who find it difficult to show us the correct translatory movements that they can follow. So what do you do in such patients? You don't ask them to go from MIP outwards. You rather ask them to open the mandible, come and bite in an edge-to-edge position, and then slide the jaw inwards towards MIP. Now remember, this is a physiologic movement for the individual because that's how the mandible closes during function. Similarly, for lateral guidance, instead of having the patient bite in MIP and then slide the jaw outwards, you tell them to open the mandible, contact the canines and then slide the jaw inwards, going from MIP out as against biting out and then coming towards MIP. The line that you get for excursion will be the exact same. Now remember, protrusion is the first movement that we do because for us to bite food, we first need to incise food. Now when we're talking about protrusion, if I bite down an MIP and I protrude forward and come edge to edge, all the back teeth should completely disocclude. This is the Christiansen's phenomenon. That is, a wedge-shaped space opens up as soon as the mandible goes into a protrusive movement. What is the ideal protrusive guidance pattern? All the four lower incisors are being guided by the palatal surfaces of all the four upper incisors. That's ideal. Not always does that exist. Should I run behind achieving it if I am doing a full mouth rehabilitation case? No. Even if I can get two central incisors to guide the lower incisors, that is absolutely acceptable. What is not acceptable? If only one single incisor is guiding. If this incisor alone is guiding in protrusion, this incisor tends to get overloaded. When it gets overloaded, it tends to migrate away. There is a frematist that steps in. There may also be a situation of attrition or worst case scenario, even tooth or prosthesis fracture. So this is in protrusion. Once the incising activity is completed, now comes the act of chewing, which involves lateral movements of the mandible. Now mandible functions in a specific arc or a pattern which is called as envelope of function. Now very simple, bolus of food is rolled upon the tongue. The tongue now puts it onto the occlusal surface of one side. Let's say it puts it on the right side. What will the mandible now do? The mandible will deviate towards that side, will crush the food, and then the inclines of the teeth will guide the mandible back into maximum intercuspation. So this path that the mandible takes, which resembles a teardrop, is the envelope of function. This envelope of function exists on the side where the food bolus is present, which essentially is the side that the mandible is moving towards. This side is called as the working side because this is the side where the actual movement and masticatory load is being applied. Now, when it comes to the sideways movement of the mandible, two patterns of disocclusion exist, namely canine guidance and group function. In the upcoming video, we shall be discussing about both of these individually. Thank you.